10 tips to cope with morning sickness. Hello everyone, welcome to Personal Transformation Channel for pregnant mothers. The topic of this video is 10 tips to cope with morning sickness. I am your coach Elizabeth here. I'm a writer and a motherhood coach, and I coach and guide pregnant mothers to have an enjoyable and memorable pregnancy. 10 tips to cope with morning sickness will include the followings. What is morning sickness? Morning sickness causes. Morning sickness cure. What is morning sickness? Morning sickness is neuralgia and vomiting that occurs during pregnancy. Common signs and symptoms of morning sickness include neuralgia and vomiting, often triggered by certain odor, spicy foods, heat, excessive salivation, or oftentimes no triggers at all. Morning sickness can be one of the first signs that ladies are pregnant. This can happen morning, noon, or night. It will normally occur in the first trimester or second trimester. Some women will continue experiencing it until the end of term. Neuralgia can happen immediately, or some pregnant mothers are not experiencing morning sickness at all. No one is certain for what causes morning sickness. It is a change in the body that happens during pregnancy. Your doctor may even advise you to take some other form of prenatal vitamin. Always find out first with your doctor before taking anything new or taking off medication, even prenatal pills. Morning sickness, causes and remedy. Causes. Morning sickness is often the first sign of pregnancy, as it can start as early as 2 weeks after conception. Despite the name, the pregnant mother can feel ill at any time of the day. Although as an empty stomach, it starts to be one of the triggers. Then morning are a common time for it to appear. Not every pregnant woman will experience morning sickness, although most of them to some degree, and it can vary from a feeling of mild neuralgia to feeling truly dreadful and unable to keep any food or liquids down. It's not known exactly what causes it, but most doctors agree that the changes in hormone levels that pregnancy triggers are the most major factor. One of the effects of these hormones is to change the way the digestive system works, which can lead to a higher levels of acid. Another possible cause is that many women experience a heightened sense of taste and smell while pregnant, which can make neuralgia feel worse when unpleasant or strong smells are around. Finally, tiredness and stress play a part, and most pregnant women are tired and stressed a lot of time. Morning sickness can occur over the full range of the pregnancy, but most women find that it more or less disappears by around 14 weeks as hormones levels in the body stabilize. Remedies. There are dozens of traditional remedies to relieve the feelings of neuralgia, with every woman having an opinion on the subject. The fact is that every woman's body is different, and so no single things will work for everyone. However, there are some simple things to try which can help most feel better. 1. Change of perspective. Neuralgia and vomiting are two common symptoms of early pregnancy. In fact, morning sickness is the good sign of placenta is doing well. Studies have shown that women with neuralgia and vomiting during the first trimester have a lower risk of miscarriage than do women without these symptoms. By changing the way to look at morning sickness can help mothers to look at it positively and thus cope better. The adopting of positive self-talk of I'm going to be fine. My baby is strong and healthy. Therefore, I'm experiencing the positive side of pregnancy. It helps mother to look at it at a positive way and increase the coping with the morning sickness. 2. Try keeping crackers at hand. An empty stomach can be a cause, so snack little and often to keep hunger at bay, and keep a couple of biscuits by the bed. For if mother wakes up during the night, she can have a quick bite to help to reduce neuralgia. 3. Ginger. Fresh ginger is good to calm the stomach, so making a tea from crushed root ginger or even chewing on a piece can be worth a try. They may try to take ginger tea when necessary. 4. Dry cereal. Dry cereal is another good thing to eat. The stomach may just be a little bit hungry and trying to tell you. Remember to take small portions. This way she will know if it is all going to come up or not. 5. Enough rest. Morning sickness tends to increase with fatigue and stress. In order to combat the neuralgia associated with fatigue and stress, pregnant mothers are recommended getting plenty of sleep. Whenever a mother is feeling tired or sleepy, go to sleep or rest for a while, as it helps to replenish the energy of mother. Take a nap of 10 to 20 minutes, help to replenish the energy during the daytime. Have a good sleeping routine, helps mothers to sleep soundly and have a good rest at night. 6. Enough fluid. Proper hydration is crucial for mother and baby's health. Staying hydrated with plain water, soup or juice. To get these 6 to 8 glasses of water, mother tries sipping from a bottle of water all day long. And to further reduce neuralgia, it is suggested to avoid drinking for 20 minutes before she eats, while she eats, or for 20 minutes after she eats. 7. Avoid trigger of strong smell. Smells are another thing that seems to cause morning sickness. Imagine walking into a restaurant and the first thing she smells is grease. This can easily set it off. Bad smells and even certain tastes gets the feel for the body during the pregnancy and figure out just what set it off. Knowing how to avoid the trigger, it can make a lot of difference. 8. Magnetic waistband. Remedies for travel sickness can also help, so it might be worth trying magnetic waistbands. But a mother should never take any medication while pregnant without consulting her doctors. 9. Breathe in fresh air. Open the window and let the fresh air go in at home. Take a daily walk outdoors may help to relieve morning sickness. 10. Seek doctor's advice. A few reasons a pregnant mother should go to her doctor would be if she begins losing weight because she is constantly sick. Seek doctor's advice if she finds that she is getting dehydrated or looking pale. Seek help from doctor or midwife immediately when she has the following. The nausea or vomiting is severe. Feeling dizzy or faint when she stands up. Passes only a small amount of urine or is dark in color. Heart races. Dehydrated. Loss of weight. Feeling sick. It is important to have a good rest, have enough water intake, going for a walk. A pregnant mother will keep herself physically and emotionally strong and healthy to cope better with the morning sickness. The positive mindset and thinking about morning sickness also helps pregnant mother to cope positively with morning sickness symptoms. This article is to be used for informational purposes only. Prior to beginning any diet or taking any medication, the pregnant mothers must consult a licensed medical doctor for advice or to determine the best course of action for her individual condition. Find out more about online course on connecting with babies during pregnancy. Happy Moms Healthy Baby course. Click the link in the video description. Subscribe to my YouTube channel and turn on notifications so you don't miss videos of prenatal bonding and much more. Check out the playlist of prenatal bonding, communication with babies during pregnancy, pregnancy tips and music, coping with emotion and delivery. I will see you in the next video. Take care.